Just a quick question, and I don't know, I suspect that this is fairly relevant for most people or a substantial amount of people that have MS. Most of you on the panel, do you typically have anemic tendencies? Are you fairly anemic? I just want to know how many of you
I was hospitalized for anemia in October with 0 blood iron.
Okay, and
stores.
I've always been slightly anemic. I've never had to be hospitalized, but from time to time, I'd get tested and my iron would be getting low. So it's been a factor.
I want to say something. I have always been anemic all the time, and they couldn't do anything, and I was very, very low to the point that I have to go to an early hysterectomy because my period was so heavy that it was getting worse and worse and worse. And then when I went to the hysterectomy, they took the ovaries and everything. So I said, why did you do that? And the gynecologist said, Sylvia, because your period is so heavy and then you are always anemic, and you have been anemic all your life. So since I got the hysterectomy, I am not anemic anymore. And they said that this is because I went to India and I got the treatment. I don't know if that is the case or not, but the only thing is I'm not anemic anymore.
Good evening. Before you had your procedure done, my question is, did they give you any blood thinners or anything to help out with the procedure? I know that some of you have afterwards been given blood thinners to help out for whatever it is that they have done, but prior to it, is there anything that the rest of us can do to maybe get an edge?
I popped a couple baby aspirin just because I wanted to be a little bit precautious. There's a patient trying to treat herself, but nobody told me to do that. But I did take baby aspirin for a day or two before.
For about 2-3 days before the procedure, we were given Clopidex, which is a type of blood thinner, and expected to take 150 milligrams of aspirin a day, and no alcohol. They told us it was forbidden. So.
And no marijuana, I saw.
I am an MS caregiver. My name is Stephen, and my wife Ruth was patient number 17 in Katowice, Poland in December of last year, and that treatment lasted 3 months, and it was a wonderful relief while it lasted. But she restenosed, and I took her back to Bulgaria, and she was treated at the end of May of this year in 2009. So she's actually been liberated twice. And what I learned in that period of time that I'd like to share with you is as follows. And so any of you are thinking of going for treatment, what I suggest that you ask for is a written diagnosis of how you're examined and how you're treated. So you have a written record of it. My wife, left jugular vein was opened in Poland, but they missed the esophagus in the right jugular, and all 3 of the veins were stenosed that they picked up in Bulgaria, and they treated them all. And she's doing fine again. And the big unknown in this whole procedure is how long the veins stay open. The other thing that I learned is that the skill of the surgeon is the essential part of the procedure, and different surgeons have different methodologies, and some are more aggressive than others in the tools they use and the time they spend and how aggressive they are. And then the last part is the esophagus vein. The esophagus vein is one of the key veins, especially for those of you that are in wheelchairs, because that's the blockage that affects your mobility. So be sure that the esophagus vein is properly examined, and there's no proper way of imaging the esophagus vein externally. They make various attempts, and it's expensive, and it's indeterminate whether the results are reliable or not. So only the venogram is the true test for the azygous vein. And we believe
Do you have
that
a question for us, though, Stephen? Because we covered the azygous with Dr. Code in the beginning.
I just wanted to share those things. And one other thing I wanted to say is regarding negative effects. If any of you have blood conditions, then it's you should have that checked before you have the treatment, because if you have fast clotting blood, then you could be worse off. And I unfortunately know somebody who's worse off after the treatment than before the treatment, not because of the treatment, but because of the specific blood condition of that person.
I think that's a powerful message for getting our primary care physicians involved here in Canada in our total health. Okay, where are we now, Braden, with questions? I see that it's 9 o'clock. I know that I'm going to stay and talk to others, but for those of you that do have to leave at 9, if you've made transportation arrangements, whatever, I will just take a moment to thank you all for coming tonight. And to, if you picked up a bookmark, there's a website which is actually just a little website that we threw together with some of the links that we've talked about. You'll be able to find just our little wisdoms of knowledge, but if, like Braden said, if you're online, you'll be able to find out most of this yourself. There's also contact information for the speakers there if you want to get hold of us. Thank you for the donations towards the cost of this event. We're 6 members of the public. We paid for this ourselves. If there's anything extra in the donation box, our promise is it will go towards CCSVI research. Somebody suggested that we do this again and keep the dialogue going. I know these speakers are committed to that, and anyone who's being treated, please come up and get your red balloon. You have been angioplasty ballooned, and that's what we want to celebrate. And so we want to keep this going, and so let's gather together again. I think look for us to do something new and different next time, but we welcome your ideas. And like we said, there's lots of things that we can do to help spreading this information out in the community so that you can follow us as we move forward in our treatment and welcome more and more onto the angioplasty side as more and more of you get treated. So I'll let those of you that have transportation coming to pick you up make your way out, and thank you for coming. And for those of you that want to stay, we will take your questions and bid the rest good night. Yeah.
I just had a quick question for Dr. Code. Are you involved in any way, or do you know when Canada will get on board with the CCSVI?
What are the doctors saying behind our backs, Dr. Code?
Well, they're extremely hesitant in general, almost across the board, with small subsets looking at different choices. So the best response is from the family physicians to date. And I also believe from the interventional radiologists. The interventional radiologists have agreed internationally that this is a venous issue that should be looked at and considered. And with or without the diagnosis of MS, they're impervious to that. So that will be the group within medicine that moves it forward. But it's a very small group. There's only 85 in Canada. If you put them all busy tomorrow with MS, it would take 10 years to go through the backlog. Okay, so that's a real issue. So, and it's too small a group to have any significant impact. So that's why the bigger push will become when it's validated and paid for within the system. So I'm really hoping that folks work with their MLA and anyone that they can contact, or their member of parliament. As you know, there's already been meetings on it in Ottawa, and I'm hoping that there will be meetings within the province here in BC fairly soon. And of course, the premiers are meeting in Winnipeg this week. Or last week, rather. So we didn't hear a lot out of that. They're going to be careful. But if they finally realize that there's a way to save some money, then they might get on board.
I know I met a woman last week, and I told her what I had done and how much it cost me to go get this treatment. And I said, "You're a taxpayer. I just saved you $30,000 a year. because I'm now not taking $30,000 worth of drugs a year that used to be paid for by the government. And so she just looked at me and goes, oh my God, we have to do something about this. All right, who has the microphone now? And like I said, we're happy to take questions, and as the crowd leaves, we'll probably be able to get rid of the microphones. But until that time, who's got the mic? And the rest of you move forward, and you'll be able to hear us if you want to stay for a few more follow-up.